Hello everyone, in this video we are going to study about a homeopathic remedy called Bufo Rana. Introduction. The common name of Bufo Rana is the toad. Prover Dr. Karl Henk. Family Bufonidae. So the common name of Bufo Rana is toad. It belongs to the family Bufonidae. It is proved by Dr. Karl Henk. Introduction. The little glands along the back of the toad's neck, when squeezed with the forceps, will ooze a secretion which is soluble in alcohol and has been proved. You see guys, right behind the eyes, the little glands which are situated, they are going to be squeezed with the forceps. On squeezing, they release a secretion. That secretion is dissolved in alcohol, proved in many humans and has been used for many complaints now as a homeopathic remedy. Sphere of action. Bufo acts on the nervous system, sexual system and skin. Constitution. Of use in feeble-minded children. Guys, you see here, feeble-minded children are those who are unable to make intelligent decisions. They are foolish and idiotic. The mental power of those children is impaired. They are mentally very slow and dumb. Prematurely senile people, so people who are having a diminished brain function like a memory loss which occurs in the old age, but that's happening prematurely senile people. Epileptic symptoms. The convulsions, the seizures occur during sleep at night. So the convulsions, they are coming at sleep and during sleep and at night. This is more or less connected with the derangements of the sexual sphere. They seem to come within the range of this remedy. So the domain of Bufo Rana is the sexual system. It covers the sexual sphere. It is adapted to children who lack the proper development, like in Baraita calf. The persons on whom the childlike state remains while the body grows. You see few people who are heavily built, normally built, but then mentally they are too like kids. The mind is still like the kids, but the body is built. Always sickly deficient, never reaching adult fullness or growth. So they are always sickly, they are deficient people, they are never reaching the adult like growth. So the mentally they are never like adult. An adult who takes on the ways of a child as a state of imbecility. You see, their imbecility is being foolish. An adult, you can look in the picture here, he's always, this adult, he's well grown just like an adult, but then he's behaving like a kid. An adult who take the ways of a kid, and there is a state of foolishness in them. People who are prematurely old or have taken on senility, like in Baraita calf. We saw that the people who are prematurely old in the picture here. You see, prematurely old women. Mind of Bufo. In Bufo, there is lack of development, which is also found in Baraita calf patients. A state of convulsions, confusion, loss of memory, and imbecility is present in marked degree. Imbecility is the foolishness. They are anxious about health. They are sad, restless. Propensity to bite. Propensity is the tendency to bite. They are howling, impatient and nervous. You see the people here, they are very anxious about the health. At times they are sad, restless. Then they are impatient and nervous. They keep on howling. Imagine the kid, okay? Here the kid's having a tendency to bite. A man who's acting like a kid here, he has having a tendency to bite, his howling. And the kid's also like a Bufo kid, you can see here, he keeps on stressing, he's very stubborn, he doesn't understand things. There is a state of confusion. Foolishness is present to a marked degree. Then it comes to the sexual sphere here. They have a desire for solitude in order to practice masturbation. So the person desires for solitude. He wants to go aside from people, away from people in order to practice masturbation. Naked wants to be. He is shameless. He is involved in lewd talks, that is dirty talks. So the person wants to be naked. He is shameless. All these features are found in the mentals of Bufo. You see, the child who's having a characters like Bufo, there is lack of development of the brain, there is confusion, loss of memory, foolishness is present, he's sad, restless, howling, impatient, nervous, he has the desire to tendency to bite the people, and he wants to be in. Then you come to the sexual sphere, he wants to be away in solitude so that he can practice masturbation, he wants to be naked, kids who doesn't want to put on clothes, he's shameless, and Louis talks. Mind, Bufo is cunning and deceitful. You see here, Bufo, the mentals, the mind is cunning and the person is deceitful. He is disobedient, insolent, abusive, and cursing. Patient is angered easily. Rage when alone. He is impatient. We saw there the patient is very impatient here. He doesn't have patience. He wants things then and there. Whatever he says, people have to obey it. He is disobedient, he is impatient, and when angry, there is rage only when he is alone. Autism and dementia. Guys, autism, it is a disorder, brain disorder, where people they behave like kids. Head. The sensation as if a hot vapor rose to the top of a head, numbness of brain, face bathed in sweat. You can see here in the picture, the face is completely bathed in sweat and they have a sensation as if a hot vapor is rising on the top of their head. Along with that, there is numbness of the brain. There is epistaxis with a flushed face and pain in the forehead, which is better by nosebleed, that is epistaxis. Guys, epistaxis is the nosebleed. Along with the nosebleed, they have a flushed face. There is pain in the forehead, and the pain on the forehead is better by the nosebleed. Eyes, they cannot bear the sight of the bright objects. The little blisters will form on eye. You can see the blister which is formed in her eye. In Bufo, the eyes, they cannot bear the sight of a bright objects. And along with that, the little blisters will be formed in the eye. Ears, the music is unbearable like in ambrosia. Even in Bufo patients, the music is highly unbearable. Every little noise is distresses. So every little noise is distressing the patient. He cannot bear noise and music. Very important, CNS, we saw it acts on the nervous system. Acting on the nervous system, Bufo produces convulsions. Bufo is a very important remedy in epilepsy. It is connected with the sexual derangement. So epilepsy is also connected, more or less it is connected with the sexual derangement. What is the causation for the convulsions? Why do these convulsions occur in Bufo? It is from masturbation or self-abuse, that is onanism or masturbation. During the menses, at night, we saw in the previous slide that convulsions come on during sleep and at night. Anger, convulsions during coition, after the teeth extraction. Also in nursing children, if the mother is angered or frightened, the child will throw a convulsion after the punishment. So the Bufo, the causations more about the sexual derangement, that is masturbation, convulsions during coition, nursing mother if she is angered or frightened, and also during menses. Then the other two things are the teeth extraction and punishment. Starting in the 3 stages, beginning with aura, it begins in sexual organs, the uterus and also from the sexual plexus. You see there are 3 things where the convulsions begin from. There is aura, that is restlessness. It begins in the sexual organs, in the uterus, and also from the solar plexus. Guys, solar plexus, those are nothing but the nerve plexus which are situated in the abdomen. These will distribute the nerve fibers to the viscera. It begins in the solar plexus, which is situated in the abdomen. There is restlessness in the aura stage. What's happening? The patient has restlessness. There is stiffness of the upper limbs, dilated pupils. The eyes are turned upwards. You can look in the picture here. The pupils are dilated and the eyes are going to be turned upwards. The person is going to do give an unintelligent speech and have an open mouth. So he speaks some rubbish, that is unintelligent speech, and his mouth is going to be open. So this is in the aura stage. What's happening? There is restlessness, which is beginning in the sexual organs, uterus and solar plexus. Along with the restlessness, there is going to be stiffness of upper limbs. Then you move to the eyes, there is dilated pupils and the eyes are going to be turned upwards. Then the mouth is going to be open and the person is going to speak unintelligently. During convulsions, there is froth from the mouth, grinding of teeth, biting of teeth, involuntary urination, and the face is red. You can see in the face what's happening. There is froth coming out of the mouth, the face is going to be red, there is grinding and biting of teeth. Along with this, during the convulsions, the patient passes urination involuntarily. After convulsions, there is going to be unconsciousness and the person goes into a deep sleep, and on waking up there is headache. Okay, unconsciousness, deep sleep and headache is found after convulsions. Hope convulsions are clear. It's very important, guys. The Bufo, central nervous system and convulsions. Under that convulsions, the causations is going to be with the sexual derangement, that is after coition, masturbation, that nursing, menses and teeth extraction and punishment. Then in aura we saw it's starting in the sexual organs, uterus and solar plexus. Restlessness will be there, stiffness of the upper limbs, the eyes are going to be turned towards upwards and the pupils will be dilated, unintelligent speech and the open mouth. During convulsions we saw in the face biting and grinding of teeth, the froth coming out of the mouth and the face is red, and also the patient passes involuntary urination. After convulsions, the patient becomes unconscious, he goes into a deep sleep and after waking up, headache. Heart in Bufo feels too large, the patient feels palpitations, there is constriction about the heart and sensation of the heart swimming in water. This is very characteristic here in Bufo. The heart, they have a sensation as if their heart is swimming in the water, and there is also constriction about the heart, and they feel their heart is too large and they can feel the palpitations as well. Female, the menses too early and copious. So the time of the menses is too early, the quantity is going to be copious, that is profuse in quantity. The menses coming early and profuse in quantity. The clots and bloody discharges at other times. So you see the intermenstrual discharges also found. There are clots and bloody discharges at other times, which means during the one menses to other menses, the intermenstrual period, they have bloody discharge. The leukorrhea is going to be watery. The excitement with epileptic attacks, epilepsy at the time of menses. So you see, during menses, the female is going to have excitement. With the excitement, they come on with the epileptic attacks. The epilepsy is at the time of menses. We saw the causation of convulsions, that is at the time of menses. So the convulsions, epilepsy is occurring at the time of menses. So guys, the menses of Bufo Rana, how is it? The time is early, quantity profuse, clots and bloody discharge will be present in between the menstrual periods, that is in other times. Watery leukorrhea and menses which is accompanied with epilepsy. Induration in mammary glands. You see induration, that is hardness in the mammary glands. It is palliative in the cancer of mammary. So guys, induration is the hardness, and then palliative is what it is. Bufo is just going to make the symptoms less severe without removing the actual cancer. It is just going to suppress the symptoms, make it less severe, that's all. Burning in ovaries and uterus, ulceration of cervix. So you see, the burning is found in the ovaries and the uterus. There is ulceration of the cervix. Along with the ulceration, there is offensive bloody discharge, and the pain from the cervix is running down into the legs. There is also the tumors and polyps of womb, that is nothing but uterus. So there is burning in ovaries and uterus, tumors and polyps of womb. Then you come to the cervix. In cervix, there is ulceration and offensive bloody discharge coming out, and the pain is running down into the legs. Then we saw the mammary glands. There is induration and it is used as a palliative in the cancer of the mammary glands. Bloody milk or milk leg. In this, the veins are going to be swollen. Milk leg or iliofemoral thrombophlebitis, phlegmasia albadolens. The synonyms of milk leg is phlegmasia albadolens or milk leg. There is tumefaction like a cord from the groin to the knee. You can see from the starting from the groin to the knee. Guys, basically what happens in this milk leg or bloody milk, it is caused by the deep vein thrombosis in the femoral vein. You see in the picture given, the vein, femoral vein, there is deep vein thrombosis, that is a clot formation. Thrombosis is there in the femoral vein. Because of this thrombosis, there is inflammation. The inflammation will be characterized by the swollen pain and a painful limb. You can see here there is inflammation of the limb, and the inflammation is starting from the groin to the knee. Then carcinoma uteri. There is distending burning pain or cramps in the uterus. So Bufo is used in cancers of uterus, cancers of mammae. In the cancer of uterus, there is a distending burning pain and cramps. There is a sharp dagger-like pain. It is worst on walking or sitting for too long. So you see the cancer of uterus, how is the pain? There is a sharp dagger-like pain, and they are also having cramps and burning pain. The pain is going to worsen when the woman is walking or she's sitting for a too long time. Then you come to the ovarian tumors, burning and swelling of the ovaries, burning, heat and stitches in ovaries, like we saw in the previous slide. There was burning in the ovaries as well as in the uterus. There is swelling and the great sensitiveness of the ovarian region. Like in uterus, there was sensitiveness, swelling. Same way here, sensitiveness, swelling, and also cramps in the ovarian region. And the cramps are going to extend from the ovarian region into the groins. There is hydatids in ovaries. So guys, you see hydatids, it's like a cyst, which is hydatid cyst which are containing fluid. So the hydatids are present in the ovary. Then you see the mammary cancer, which we saw previously in detail. Then the mammary cancer, there is induration and the milk is mixed with blood. So the nursing women, in nursing women, the milk is going to be mixed with blood. This is about the female complaints of Bufo. That is starting with mammary glands, induration and cancer. Then cervix, there is ulceration, tumors and polyps of ovaries. Then we saw uterus, and then we saw the milk leg, that is phlegmasia albadolens. Then in the cancer of the uterus, sharp dagger-like pain. Ovarian tumors, there is sensitiveness, swelling, stitching pain in ovaries and cramps. There is also the hydatids in ovaries. Because of the cancer, mammary cancer, the milk is going to be mixed with the blood. Then coming to the male sexual system. In the male, it's like impotence is of the worst kind. They have an inclination to touch the genitals. I told you in the mentals, the Bufo is very shameless. He's involved in lewd talks. Naked wants to be, so they also have an inclination to touch the genitals. They have a tendency to practice onanism with a desire for solitude. Why does the Bufo patient desire for solitude? So that he can involve in masturbation or onanism. There is involuntary seminal emission with cramps or painful heaviness in limbs. So there is the emission, seminal emission is involuntary. Along with the involuntary emission, there is cramps and heaviness in the limbs. The semen is ejaculated too quickly without pleasure sensation or fails entirely. So the impotency under a male complaints, impotency you can write Bufo, the semen is ejaculated too quickly with that leads to impotency without pleasurable sensation, and it also fails entirely in some cases. The convulsions occur during coition. Coming on to the extremities of Bufo, there is pain in the loins, numbness of limbs, cramps, staggering gait. So we've seen there is numbness of the limbs, cramps, and also the pain in the loins. The person who's having a staggering gait, that is ataxic gait, where there is an involuntary thing, the person walks, there is incoordination, there is poor balance, and also there will be swaying of the body in that staggering gait. There is a feeling as if a peg were driven into the joints. You see guys, a peg is nothing but a wooden nail. They feel as if a peg was driven into their joints. Along with this, in the extremities, there is swelling of the bones. In these conditions, you can prescribe Bufo whenever there is pain in the loins, numbness, cramps, staggering gait, and they have a feeling as if a peg was driven into the joints and there is swelling of the bones. Skin, panaretium, pain runs up arm. So about the panaretium, I'll explain in the next slide. There is patches of skin, loose sensation, pustules, suppuration from every slight injury. Pemphigus, bullae, which open and leave a raw surface. They're excluding and ichorous discharge. So the discharge is going to be very corrosive. They're exudating a ichorous fluid, and there is also bullae formation. There are blisters on the palms and the sole. You can look in the picture here, the blister formation on the palms and the soles. There is itching and burning, and along with the blisters there is also carbuncles. So guys, you see in the skin complaints there is pustules, blisters, carbuncles, bullae and pemphigus, and also panaretium. You can see the blisters in the picture. Now these pustules and the blisters, they undergo suppuration. The suppuration is formed from the every slight injury. And the fluid, it is going to be very ichorous discharges. The discharges are very corrosive. There are ichorous discharges from the bullae. Panaretium, guys, this is a picture of panaretium. The pain is going to run in streaks all the way up to the arms. There is swelling blue-black around the nail thumb. This is followed by suppuration. So guys, then the panaretium, there will be acute pussy inflammation, which is found at the end of the finger. That commonly vitilo we say. So this is vitilo, panaretium. And because of this, the pain is so severe that it is running round of the streaks around the arm. Then we come to the last thing, the modalities of Bufo. It is worst in a warm room and on awakening. It is better from bathing or cold air, from putting feet in hot water. So you see, when the person is in a warm room or on waking up, the symptoms are going to aggravate. And when he's taking bath or in cold water, from putting the feet in the hot water, it is going to ameliorate the complaint. Thank you. With this, we come to end of Bufo Rana. If you have any doubts, put it in the comment section. And if you like my video, hit the like button and subscribe to my channel.